They are often referred to as warriors in Nigeria for waging war with this health challenge to survive. Carriers of sickle cell disease (SCD) who have adhered strictly to medical counsel have proved that the condition isn't a death sentence.
Some people feel that, or they've heard that once you're a sickler, you cannot live up to 18 years, you cannot live up to 20, some people say 25 years. But at our clinic, we have warriors who are above 55. We have some who are close to 60. And this was being possible because they were able to get the health maintenance tips, daily health education on different aspects of how to live a longer and a better life.
There are likely symptoms mothers should look out for, and Iyobosa Juliet Arono, a research nurse, highlights some of them.
While we emphasize coming for routine care, the mothers are taught how to palpate or check for the spleen every time they are bathing the baby to check if it is hard or if it is swollen. And there's a way we teach them how to measure it. You understand? So when it is enlarged, it is swollen, they can feel it as they are bathing the baby. It is directly below the rib. So we ask them to always watch out for that. You see the child starts crying, the hands are swollen, the legs are swollen. It's called hands and foot syndrome. So we advise mothers, once you see this and the temperature is high, please take the child to a nearby hospital for proper care.
Olariwaju Salau and Blessing Bedium are both 35 years. They share with me some of the challenges.
I have passed through work stigmatization in so many aspects. I don't normally hide that I'm a sickle cell patient, so I always tell them my checkup days. In some schools, the owner of the schools might say, okay, you can go. Some will say, no, now only you nine dey sick, that kind of thing. In this our school, nobody dey sick, or that kind of thing. And when you are sick for some few days, they'll be telling you you're the one bringing down the school.
Well, growing up, we didn't have as much advancement in the health sector just as we have now.
Salau, now a father of two, revealed a sharp contrast between growing up when access to qualified medical personnel was limited and the present when care has improved.
We have people, doctors now, that actually know exactly what they're doing. They can really know how to treat you better. And then the advancement in the drug area, we don't just, before it was just folic acid and paludrin, then we have other drugs now that you can use, like hydroxyurea, which has been helpful in the
Since 2009, June 19 every year is now dedicated as a day to identify with these warriors. Experts now call for more sensitization to tame its spread.
The first thing is, as much as possible, people who are carriers of the traits should not marry carriers too, so that they don't give birth to children with sickle cell disease. Another thing we can do is early detection. Screen these babies as soon as they are born. Find them early, put them into care, and manage them properly.
And for our government, we're actually advocating that they should put sickle cell disease, they should give it a priority to see how those who are already identified can be, the burden of care can be reduced on their part.
Recognized as public health problem, sickle cell anemia in National Institutes of Health (NIH) document affects 20 to 25 million people globally, out of which about 15 million reside in Africa, and Nigeria is believed to be the most sickle cell endemic country, with 2 to 3% of the total population affected.